All right, guys, welcome back to Underground Science. And in this video, we're going to be talking about senile cardiac amyloidosis. Okay, so let's go and get started. So, senile cardiac amyloidosis is basically an age-related amyloid deposition in the heart. All right, so that's the main thing we have to know. It's an age-related amyloid deposition in the heart. So let's go and note that down. Okay, so the main thing we have to know that senile cardiac amyloidosis is age-related and so let's write this age related, and which leads to, right, it's age related amyloid deposition in the heart, right, hence the name senile cardiac amyloidosis. And actually, so let's just know this for now, and then let's talk about what kind of misfolded protein, because remember, amyloid is misfolded protein. Okay, it's misfolded protein that can deposit in the extracellular environment, right? Outside your cells. And obviously that can lead to damage of your tissues. So in senile cardiac amyloidosis, you basically have a deposition of transthyretin that has misfolded, okay? Misfolded transthyretin protein that deposits as amyloid in your cardiac walls, okay, of your walls of your heart. So So first we have to know, okay, well, what is transthyretin, right? So let's write that down. Transthyretin, normally what it does is it's actually a normal serum protein that basically travels in your blood, okay? So let's say we have our blood vessel here and we have our transthyretin here. Let's say it looks like that, right? What it does is it floats in your blood, travels in your blood, and it actually transports thyroxine. So it transports T4. Okay. So let's say we have T4 in orange. So this would be T4. And then, of course, in yellow would be transthyretin. So one job of transthyretin is to transport T4, right? And then another job of transthyretin would be to transport retinol or vitamin A. All right. So another job of transthyretin we can draw here. Let's say that's transliterating, which is obviously a really bad drawing. I'm not a good artist, so so let's say that actually wait, let's do a different color for that. Let's do white. So let's say this is a vitamin A, okay? So transthyretin, what it does is it's a normal serum protein that transports T4 and transports vitamin A. Over time, what happens, or with aging, this protein, transthyretin, can actually misfold and aggregate. Okay, so it can misfold and aggregate. Okay, so what that's going to lead to is amyloid deposits in the myocardium. So once this transthyretin misfolds, it starts to aggregate in your myocardium as amyloid. Okay, and so usually senile cardiac amyloidosis is asymptomatic. But what happens is it can lead to restrictive cardiomyopathy, but usually it's important to know that it's often asymptomatic, okay? But it could lead to mild restrictive cardiomyopathy. All right. So of course, if you were to do, let's say, if we're talking about diagnosis, right? If we're talking about diagnosis, if you were to do an echocardiogram, right, you may see a your left ventricle wall be thick because of the amyloid deposits in the myocardium, right? So you may see left ventricular wall thickness, let's say, right? Because remember, again, this is often asymptomatic, but if it were to progress to mild restrictive cardiomyopathy, you may see increased left ventricular wall thickness with a normal ejection fraction. That's important because remember, restrictive cardiomyopathy is heart failure with preserved ejection fraction. But if we look at Dilated cardiomyopathy, that would be heart failure with reduced ejection fraction, okay, which we'll talk about when we talk about cardiomyopathies in the cardiovascular playlist later on, okay? So normal ejection fraction. So again, heart failure with normal ejection fraction or preserved ejection fraction would be restrictive cardiomyopathy. Okay, and if so that you may see left ventricular wall thickness with normal ejection fraction if you do an echocardiogram. If you did, for example, if we did a biopsy, right? If we did a biopsy of the heart tissue, right? Then, as we know with amyloid, what we would see is apple green birefringence on Congo red stain. Okay, that phrase is particularly important when we're talking about amyloid protein deposits. Okay, so we would see apple green birefringence with on Congo red stain. Okay, so that's an important phrase to know because if you do the biopsy, you'll see apple green birefringence on Congo red stain under polarized light. All right, so that can give you another clue about amyloid deposits in a specific tissue. Okay, so that's basically it for senile cardiac amyloidosis. And then next, we'll in the next video, we'll cover other types of amyloidoses. All right, so I hope this made sense a little bit. I hope this helped a little bit, and I hope to see you guys on my next video. Thanks for watching.